8:13 now, WWL First News Time, and we welcome our friend, Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health. How you doing, Doc?
Hey, Tommy, I'm good. How about you?
I was outside just now, and this is perfect to me. Maybe a little colder, but I'm not going to complain.
Really? See, I'd like it a little bit warmer, but it is wonderful.
So we're both happy. Your health conditions, lifestyle, your doctor's treatment plan all affect your health, and taking your medications on time and exactly as prescribed is an important part of managing your health, and that's what Dr. B is going to talk with us about now. Medication adherence and making sure you have the right drug coverage. So, Doc, these are powerful chemicals, and if you don't take your medication as prescribed, you can have some bad results.
Yeah, exactly. I mean, medication adherence is a really big deal. It's important to take everything as your doctor tells you to. And if you don't, a lot of bad things can happen. It obviously can worsen any of your medical conditions, could create a decline in your health. But it actually could lead to hospitalization or something even worse. So, your doctor is really the only one who should tell you when to start or stop taking your medications, or especially to change your routine, how often you're taking them or even when you're taking them during the day.
I know one thing I've found is that if for whatever reason I run out and the refill doesn't come in or whatever, I just stop taking it. And you got to be on top of that. You got to make sure that you just don't stop because it's not there, right?
Yeah, definitely. Don't run out. That's the most important thing.
Step. Yeah. If somebody says some of the following things to you, what would you say to them? If somebody says, I feel fine, I don't need to take medication, my medication.
Yeah, we hear that every day. And really the thing to keep in mind is that the reason you feel fine is probably because your medication is working. So you don't want to stop because then you probably won't feel fine.
Guilty as charged. Another one says, what about this if somebody says, I don't like to take my medication because of the side effects?
Yeah, I hear that one a lot too, and it is true. Medications can have side effects, and the side effects can differ by person and by drug. But keep in mind that we've got millions of drugs that we can use, many for the same condition. So if one is not working for you or you're having a problem, don't just stop taking it. Talk to us, and we can probably find another drug that's more tolerable to you.
Some things getting some attention on Capitol Hill. My medications are too costly for me to fill them.
Yeah, this is a problem nationwide, obviously, and there's a lot of work being done on it. But, one thing you can do right now today is talk to your doctor about generic versions of your medications. Most medications do have a generic version that's going to be much less expensive than the brand version, and they work just as well. So, so that's something to think about. The other thing for anyone who's on Medicare is you could be eligible for something called Medicare's Extra Help program, and that's a program that actually helps you pay for your medications, and it's based on some qualifications. So you do need to talk to your local council on aging to see what resources may be available for you, but don't just go without. There's usually help to get those medications for you.
And that's a symptom in a way, right? If you can't pay for your medication, your physician needs to know that.
Yeah, definitely. And actually, sometimes people won't tell us because they may be embarrassed that they can't afford their medication. But, if we put you on something, we think you need to be on it for whatever your disease is. So let us know, and we'll do some work. We've got a lot of resources that can help to try to get you what you need.
The doctor's seeing you in that hospital gown. Finances are the least of it. What about one of my medications looks different than it did before, so I must not need to take it the same way?
Yeah, that definitely does happen. So if you are on generic versions of a brand medication, sometimes there are multiple manufacturers. So occasionally what will happen is, you may be taking a round purple pill, and the manufacturer changes, and the pharmacy then gives you a square peach-colored pill. It's the same medication, but if that does happen, what you need to do is, talk to the pharmacy, make sure they gave you the right medication, and if it is the correct one, then you want to definitely take it. It's going to work exactly the same. The color and the size and shape of it don't matter.
How about some tips for people to stay with their medication plan, keep it right?
Yeah, there's a couple of things you can do that I usually suggest to people. The most important thing is creating a routine. You want to take your medications at the same time of day each day. What I tell people, if you usually need to take your medicines in the morning and maybe take them with food, do it every morning when you eat breakfast. Have them kind of sitting in the kitchen ready to go. That helps you stay organized. And another thing people use that's very helpful is pill boxes. And even if you're only on, a handful of pills each day, if you use a pill box, you can place them in each day, so you make sure that you took it. And if you actually accidentally miss a day, you're going to see that they're in the pill box. And there are some pill boxes that are high tech. They have alarms built into them. You can actually set it to ring so that you need to take your medications. And then, everybody carries a cell phone, so you can create reminders on your cell phone to remind you to take your medication as well. The other big thing that you just mentioned is on refills. You want to make sure you're kind of keeping an eye on how many pills are left in your bottle. And so if you're running low, call the pharmacy. You can refill your medications usually about a week or so before they run out, and you don't want to wait until the last minute because occasionally there'll be delays and then you'll be without your medicines for a few days. And, one great way to avoid that problem is to go with one of the automatic refill programs. Pretty much every pharmacy now has a program you can sign up for that will automatically refill any medicines you're taking on a regular basis. They'll contact you either by phone or by text and tell you, hey, it's time for your refill. So that's a real great way to remember to make sure that you take it. And then the last thing I'll tell you, a lot of people don't realize this, but like I mentioned, there's a lot of different drugs that we can use for the same conditions. So sometimes we can simplify your treatment. If you see multiple physicians, you may get put on multiple medications, and every once in a while we need to review that whole list and see if maybe we can eliminate some things or combine some drugs so that you're taking less pills. That'll make it a little bit easier to stay compliant.
I don't take that many, but that pill box is a great way to work ahead and to make sure you don't run out because you work 7 days out, right? And you can see that you're out, and then you can take care of that. We'll take a quick break. When we come back, we'll talk about original Medicare, what drugs aren't included. What about the Doughnut Hole? A lot of information here. Stay tuned. 8:21. Back in a flash with Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health. Right now, though, we take a look at traffic. It is currently 8:25 WWL First News Time. I'm Tommy Tucker talking to Dr. Brent Wallis, Dr. B, Chief Medical Officer of People's Health, about adhering to your medication and making sure that you take it when and how you're supposed to. And now we're going to talk about how you can afford it. Dr. B, if somebody's on original Medicare, drug coverage is not included, right? So what are their options to get that coverage?
Yeah, a lot of people don't realize that original Medicare doesn't include any sort of drug coverage. So you've got to add on an additional plan or a replacement plan to cover your medications. And if you don't do that right away, and you want to do it later in life, sometimes you'll even face a penalty. So there's really two main options that you can choose. The first one is what's called a standalone Part D coverage. Part D, remember, is D for drugs, and that will cover your prescription drugs. Those plans have been around for about 15 years now. The problem is, just like the price of drugs, those plans keep going up in cost. In fact, they've gone up by over 50% over the last 15 years, so it can get expensive. The second option is to choose a Medicare Advantage plan. So Medicare Advantage plans most often include that Part D prescription drug coverage. So with People's Health, for example, you don't pay a separate fee to have that prescription plan. It's actually included all in one. And the other nice thing is that People's Health plans, for example, you can get a 90-day supply of any of those Tier 1 or Tier 2 generic medications for absolutely no cost at all, $0. So that can really help your wallet in a big way.
And then there's the dreaded Doughnut Hole, right?
That is correct. So the Doughnut Hole is
what is it?
it's a very confusing and changing issue with Part D coverage. So really the simplest way to think about it is every year it changes usually. So that's why it's so confusing. But what happens is when you hit a certain dollar value in the total cost of your medications, and like I said, that value keeps going up because drugs are so expensive. Right now it's a little over $4,000. When you hit that cost, then your coverage decreases. So you have to pay more for your drugs all the way until you get to the other side of the donut, which is at around $6,500. So for that interim period when you're, kind of, quote, in the donut hole, you're going to have a higher cost for your medications. So one other thing that's unique about people's health plans is that those generic Tier 1 and Tier 2 drugs are covered straight through the gap. They're $0. So even though you may hit the donut, your out-of-pocket cost changes are not going to they're not going to increase. So that's something to really think about, kind of figure out what the total cost of your medications is going to be for the year, because that donut can be really devastating for a lot of people.
People's Health 5-star rating, there aren't a lot of those around. How can people find out more about People's Health, Doc?
Yeah, we're very excited about that 5-star rating for 2022. But if you want to find out anything else about us, definitely go to our website at peopleshealth.com. But we've also got a great new Medicare Center that's located right in Metairie, right next to Party City at Veterans and Causeway. And, you can make an appointment online, but you certainly can come and walk in and see us and ask any questions that you have.
The percentages of plans that have that 5-star rating?
Yeah,
it's
right now
crazy.
A very low percentage. I believe we are one of two right now in the area.
It's very
that
rare. I know that.
5-star plan. Yeah, very rare. We're excited.
Congrats on that. Thank you, Doc. I appreciate your time. Have a good weekend. Enjoy the weather, all right?
All right. Thanks, Tommy. You too.
You bet. You can go to peopleshealth.com. You can call 1-800-978-9765. And, of course, you can also visit the center he was just talking about, People's Health United Healthcare Medicare Center, 3017 Vets in Metairie. That's next to Party City. Appointments are recommended, but walk-ins are welcome. And, of course, you can follow People's Health on Facebook, Twitter, and Instagram.